This is a recording of this year's Virtual Residency Fair. We'd like to take the time to thank the programs that volunteered their time to present to this year's applicants. This year's PM&R Scholars Virtual Residency Fair is supported by PM&R Recap and Ultrasound Guidance. PM&R Recap is the leading resource for your physiatry board preparation, clinical preparation, audition rotations, and beyond. PM&R Recap offers 35 hours of review videos, hundreds of review questions, and oral board cases to help you become the best physiatrist that you can be. Head to pmnrrecap.com to learn more. Ultrasound Guidance is the innovative new online ultrasound learning platform that gives you instant access to expert instruction. With rapid scans and complete scans of every joint and peripheral nerve, Ultrasound Guidance is the perfect way to jumpstart your MSK ultrasound learning. Visit ultrasoundguidance.com to learn more.
How's it going? My name's Matt Cassio. I'm the academic chief at Nassau University Medical Center. I'm joined by two of our PGY3 residents, Anu and Diane. And gonna start a screen share so you guys can see our presentation. All right, so Anu's gonna start us off here.
All right, so I'll kind of go into a program overview, but I'm just one of the PGY3 residents. I go by Anu, but my full name's Anirudh. So we're a level 1 trauma center and one of the few level 1 trauma centers in Long Island, being in East Meadow. So we get a ton of traumas, not just from around East Meadow. A lot of patients get sent over from other hospitals. So we get quite a bit of interesting trauma pathology. We are 13 residents, so it's 4, and then every 3 years there's a class of 5 residents, and we're an advanced program, so our intern year is separate. Multiple residents have done the NUMC transitional year, and then other ones have done separate years, like myself and Diane. We both did different areas. If we go to the next slide. So curriculum, I think one of our strong suits is that we get a really strong outpatient exposure. So even from PGY2, while you do your general rehab floors, we actually get quite a bit of clinic time. I myself had at least 3 months, and I thought that gave me a really good exposure to injections, seeing patients in the outpatient setting, but also still having a strong basis in general rehab. We take Q4 home calls, so essentially the PGY2 split it. One of the nice things is our calls tend to be fairly light. There was a lot of nights where we really didn't even get paged at all, which was really nice. And you get 4 weeks vacation, which I really like. And then once you're a PGY3 and 4, you're on the inpatient side, you do mainly neuro rehab, and you get plenty of clinic time. We have really strong EMG exposure. There's residents from other programs that actually come to our hospital to participate in EMGs because we have such good exposure and teaching from our attendings. And we also get one thing I'll shout out, one of our old academic chiefs, Dan Skura. He actually set up an elective rotation for us now that we're allowed to go to different academic institutions. So I myself will be going to UVA in October, and Diane's looking to go to Montefiore. So it's really cool that we're getting the chance to rotate away at different places that we might consider for fellowship. And otherwise, we can go to the next slide. So for our inpatient rehab unit, it's 25 beds total between our neuro rehab and our general rehab service. And we see quite a big variety: strokes, TBI, we'll see some spinal cord injury. And then on the gen rehab side, we'll see quite a bit hip fractures, burns, because we have a large burn unit on the floor above us. Tons of trauma patients, obviously orthopedic things that are classic rehab. And then in our outpatient clinic, we see quite a bit of interesting pathology. As you can see, the entire breadth of PM&R between P&O, spasticity, pain, all sorts of stuff. On the consult side, it's standard consults. We evaluate the patients, we'll follow them, consider and bring them in for acute rehab or recommend for other types of rehab, things like that. And again, I'd like to highlight our really strong EMG exposure. And then next slide. And then this rotation I'm actually on right now. So this is 1 month a year. You actually go down to Mount Sinai South Nassau, about 15 minutes south, to Dr. Cruz's clinic. And so he has a fellowship in TBI. So he sees a large TBI population, post-concussion syndrome, but he also does quite a bit of sports medicine between EMGs. He has a heavy injection volume as well. So we get really comfortable with needles over his. And you also do consults over that rotation. So it's a really interesting mix. It's a little bit different than our standard NUMC, the way that NUMC operates, and it's also a little different in terms of the flow of the clinic. And I'll hand it over to the next slide.
One of the other rotations we do is we actually go over with Northwell. We do a month of interventional pain, usually doing the PGY 3-year, get hands-on, doing, all sorts of bread and butter interventional pain procedures, and, you're doing them. So it's definitely a good experience in that sense. One thing I can talk about is our didactics. This is a schedule that, we have pretty good kind of free reign over. The academic chief at our program basically designs the entire didactic schedule. So this is something I've been working on throughout the year. We have a really, good amount of didactic time. We got 3 hours on Wednesday mornings and 3 hours on Thursday afternoons. Some of the things we've done this year so far is a kind of physical exam boot camp course. We've been doing an alumni career lecture series where we get all of our alumni to come talk about their different career paths and kind of help our younger residents figure out what they want to go into. We have a hands-on fluoro spine model course where we have a interventional pain doc come in and teach us some hands-on fluoro guided procedures. Every month we're doing a new ultrasound course, about 3 hours every day. We did it today. It was great. We have an anatomy course. We go do a cadaver course, usually during March or April, just to help kind of reinforce anatomy. We do EMG case of the month, other hands-on lectures, journal clubs, TBI lectures, P&O, and we prep really well for SAE reports. Some of the benefits, we get $100 stipend for educational materials every year, $500 total for conferences throughout residency, $160 total for the residency for wellness money. We get coverage for Kessler board review course that happens every March for the senior residents. We get access to the PM&R Q Bank, and there's on-campus housing available at a pretty good rate. Some of the extracurricular stuff that we do, both to enhance our experience and make ourselves more competitive fellowship applicants. So we have a in-house anesthesia attending who does pain management. There's no anesthesia residency here, so it's basically just us working with this guy. We work with him in our clinic, and he also has a day where he does interventional procedures. I'm someone who's going into pain, so I've done a good amount throughout my 2+ years here now. We do epidurals, SI joint injections, medial branch blocks and RFs, geniculate blocks and RFs, intra-articular injections under fluoro and ultrasound. I've done some spinal cord stem and DRG trial and implants, and all sorts of ultrasound and fluoro guided nerve blocks. Diane is interested in sports. She and some of our co-residents have been working with Malloy University, which we have a kind of contractual agreement with. We do pre-participation physicals with them. We cover sports games, including soccer, basketball, rugby. So that's a really good experience for those of us who are really interested in sports medicine. And then on top of that, we do a good amount of research. So we have some IRB approved studies that we have ongoing. We do a good amount of case reports. We do QI project every year, and some of us have actually been involved in writing some book chapters as well. So.
All right. We also have great camaraderie amongst our residents. We enjoy working with each other and helping each other out, which is great. And then this year we have a wellness liaison that's in charge of coming up with wellness events for us. Last year, one of the wellness events was the holiday party, where we had everybody's significant others come and we hung out after work, had an open bar, lots of great food. This year we had the happy hour for the new PGY2s. We had the gala where we hung out with our attendings, graduation party. We participated in the New York City Marathon, and not participated, volunteered with the medical volunteers. And we also had a sporting event where we played wiffle ball and played basketball afterwards. Next slide, please. So about the location, we're located in East Meadow, Long Island. We have Eisenhower Park a couple of blocks away, which has lots of things to do. They have golf, mini golf, an aquatic center, an ice skating rink, basketball courts, a lakeside theater where they have festivals and movies sometimes. We're 15 minutes away from Jones Beach by car, 6 minutes from the gym, 45-minute car ride to New York City without any traffic. With traffic, it's like an hour to an hour and a half, and a 45-minute train ride to New York City via the Long Island Railroad, and a 10-minute ride to Roosevelt Field Mall. And then residents have great matching rates into the fellowships of their choice. Over the last 10 years, multiple residents have matched at pain medicine fellowships at places like University of Michigan, NYU, Penn State University, VCU, and USF. We've also had a couple of residents match into sports medicine at SUNY Downstate, NYU. We had a resident match into cancer rehab at Memorial Sloan Kettering, TBI at Burke, JFK, Mount Sinai, hospice and palliative care at Northwell Health, interventional sports and spine at Cleveland Clinic and OSS Health, and pediatric rehab at Montefiore. And then to summarize our program strengths, we have excellent board and SAE preparation thanks to our didactics. Multiple residents this year scored in the top 5th percentile of SAE, which is our in-service examination. And it's a long tenured program with history of alumni in many different fields, so we have lots of connections. And the residents have a strong record of high volume research, as stated before, and it's a very resident-driven program. We'll take any questions and follow us on Instagram. Four, 4, 5. So there's 4 PGY2s, 4 PGY3s currently, and 5 PGY2s, 4 PGY3s, and 4 PGY4s. No, I'm not the only female. There's one other female, but it's been great. Everyone's supportive. Everyone's great. The call schedule, it is home call. Inpatient rehab, are you taking care of all the patient's medical conditions, or are there hospitalists? So we have medicine around, so we can always consult medicine, but we are the primary team when they're on our floor, but we can consult. We have lots of services at NUMC, so we can consult whoever we need. Do you want
Yeah, we have the full range of special. Oh, I'm sorry. We have the full range of specialties available, as it's like a large tertiary care center. So almost any specialty you can think of, we have available to us.
Do you offer rotations to visiting med students?
Yeah,
we do, right?
we do. I think our hospital is a little bit limited in the. I don't know if they accept students from every medical school, but yeah, we do allow visiting medical students.
What does oral boards prep look like for you guys?
So one of our attendings actually is an examiner for oral boards, or has been previously. So he comes in kind of towards the end of the year and does a couple lectures for us on basics of oral boards prep. The program, I think, actually provided all the graduating residents with a oral boards prep book this past year, so they should be pretty well prepared for oral boards. Is it possible for medical students to join for any didactics or grand rounds? Honestly, that might be a little tough unless you're kind of rotating with us. Noel and Joseph, good to see you guys again. Anyone else have any other questions? Yeah, so the elective thing is new. So we had two of us applying for pain fellowship this past year. We both find out where we'll end up in September. My co-resident who applied, she actually was able to do a elective prior to application, and I'm sure that definitely helped as far as fellowship application for her. Again, we get 2 weeks of elective time outside of the program, outside of the general rotations that we have, and that definitely seems to be enough, for getting a rec letter, showing your face at another program. So it's been good so far.
And for those electives, so it's the 2 weeks that we schedule that can be anywhere. And then on top of that, we get 2 weeks with Dr. Qureshi, like if we're interested in pain, for example, where you get to procedures. And then like Matt mentioned earlier, we also have access to procedures. Right now, every Thursdays, Dr. Kador does procedures before like the workday starts. So we're all, pretty much anybody's available to go as long as you're in the hospital.
Anyone else have any questions? If not, we can definitely wrap it up.
If there aren't any more questions, we can definitely end a little early, but it's up to you guys.
And no, at the time, we don't work with any adaptive sports programs.
Do you guys feel are the strongest components of your residency program? I would say it's kind of the ability to kind of carve out what you want to do, right? So our program, like we kind of said, is very resident driven. You can kind of take what you have and really roll with it. So we see like a very diverse breadth of patients. We work at a community hospital. We end up seeing, a very diverse patient population, and we see a lot of, really interesting pathology. So that leads to, us being able to do a good amount of case reports. We do, a good amount of research. There's just a lot of opportunities to kind of carve out your own niche and kind of build your CV, build yourself up, become a, good fellowship applicant, become a good job applicant, become a good doctor. You're very hands-on from day one. Walked in my first day of clinic and, doing an injection. Obviously I had my attendant guiding me through it, but we're very hands-on at our program due to it being, a community hospital. And I think that that's definitely an advantage of being able to be somewhere where you're hands-on. I know, for myself, I learned best being hands-on. So I would say hands-on and the ability to kind of take the reins and, make the program what you want it to be.
I would also say, jumping off Matt's point, is just like he said, you can carve out your own role and carve out what you want to do. There's a lot of freedom given with that. So it gives you the ability to really push each other to do well. So I think I would definitely say our co-residents, we really pushed each other to do well on our SAEs, do a lot of research, pursue other extracurricular activities. So, and I think that's led to the really strong matching that we've had these last few years. So I would say the residents, in my eyes, are really a very strong point here.
All right, thank you, everyone. I think we'll wrap up there. We appreciate you all for this great presentation. Thank you for your time tonight.
All right, thank you so much.